We have been working feverishly on this initiative on 185. It's very important to St. Peter's Health and to our community here in Helena. We have a lot of patients that come to our facility, and what we're excited to see is that those under Medicaid expansion are actually entering our system, if you will, the best way possible, and that's through primary care. So we're seeing these patients be able to have access to care, to routine screenings. You may have seen the article last week that came out in reference to some of the data now that we're able to share across the state, the kind of a new tool that we have. And we're seeing that many of these patients are getting very important screenings, cancer screenings and things like this that can allow us to provide preventative care and ultimately over time provide less expensive care and also care that will help improve people's quality of life. So that's very exciting for us to see that happening. This is such an important initiative to our local community, to our institution. Economically, it's a challenge. In states where expansion has not been extended, the closure rate for rural hospitals is 6 times what it is in states that do have Medicaid expansion. And so we know that we're not only protecting our local communities, but we're protecting the people within those communities because it allows them to have access to health care that they might not otherwise have. So it's a thrill to have the governor with us this morning. We have a couple of other speakers that will be addressing us after Governor Bullock, John Brewer, Carly Sell, Todd Wampler, Dr. Todd Wampler, and also James Holbrook. So I will turn the time over to the governor for his remarks, and then following him, we'll hear from those other individuals, and we'll go to that point. Thank you, Governor.
Thanks so much, Wade, and thank all of you for being here today. It's great to join folks from across Helena's healthcare community who see each day in their professions the harmful consequences of tobacco products, but also seeing the positive benefits that Medicaid expansion can certainly provide, not only on our hospitals, but our communities and our businesses and our mental health providers and our substance use disorder providers. The help that it can make all across the spectrum. Out-of-state tobacco companies have now dumped in about $12.5 million into Montana to deceive voters. They're flooding our mailboxes, they're all over their airwaves, all with misinformation and fundamentally all to protect their profits. In fact, just one of those out-of-state tobacco companies has spent 3 times more than any committee in our state's history opposing a ballot initiative. Big Tobacco's not doing this out of their big tobacco hearts. They're doing it to protect profits and to try to confuse voters along the way. So today, really want to both stand up to those tobacco companies and clear the smoke around ballot initiative I-185. A couple things that you've heard versus what reality is. I-185 fully funds the state's share of Medicaid expansion. It's Medicaid coverage for 100,000 of our friends and neighbors across our state. Let me say that again, it fully funds all the part that the state will have to be paying. So the idea that there's some unfunded mandate out there is completely false. It'll also help to reduce smoking and fund other essential services that'll help our veterans and our seniors and others that have earned and deserved those benefits. I-185 raises the tobacco tax, which we also know will help reduce smoking, the #1 cause of preventable death in Montana. With I-185, if you don't smoke or you don't chew or you don't vape, guess what? You don't pay. And we can hold tobacco companies accountable for the nearly $800 in taxes that every single household in Montana pays to cover the costs of smoking and smoking-related illnesses today. Each and every one of us are already paying for that in every one of our households. I-185 will also help protect and preserve health care access for all of us, especially for folks living in rural Montana. Wade noted that states that didn't expand Medicaid, hospital closure rate is 6 times faster in rural areas. In Montana, since we passed this, we haven't lost 1 hospital in our entire state. And for those of you or for those of us that are from rural Montana, you know that that hospital is the lifeblood of the community. If you lose that hospital, you've lost that town. I-185 will help protect that. Uncompensated care costs have dropped by nearly 50% since we expanded Medicaid. That's what's helping keep the doors to our rural hospitals open. That's what's helping in the cost shifting that occurs for those of us that have insurance to those of us without. Because we expanded Medicaid in Montana, our uninsured rate dropped from 20% to 7% today. And this isn't just about healthcare. And Jason, it's great from the local chamber for you to be here, because this is also about sort of the economic vitality and the business vitality of our state. Medicaid expansions created 5,000 jobs in our state, nearly $300 million in new personal income. It's infused over $500 million new dollars in our state's economy that otherwise wouldn't be there. And don't kid yourself, we were talking with some folks earlier. Like, if we didn't expand Medicaid, it's not like you'd all get checks back from the federal government. That money would go to provide health coverage in other states. I would much rather our tax dollars be paying to fund healthcare in Montana than New Jersey or other states for certain. Our veterans and our seniors also benefit from I-185. Ballot Initiative creates new revenue to provide much needed suicide prevention support to our veterans and to help fund veterans' nursing homes. And let me clear the air around this too, because Big Tobacco has been saying, well, it caps money going to veterans. Don't kid yourself. I-185 would actually provide $2 million new money to veteran services each and every year. It's not like there's a flow of money coming from the state right now. It's dedicated, and that money's dedicated because of the initiative to the Montanans who've served our country. And if you look at that 100,000 population, 100,000 more Montanans have health care because of Medicaid expansion. Almost 10% of that, 9,500 of those getting health care through Medicaid expansion have served our country by wearing a uniform, or are family members of those that have. Not everybody that served our country is VA eligible for services. Almost 10% of that expansion population are our friends and our neighbors that have served our country in uniform. Plain and simple, I-185 assists and provides much needed support to veterans. It'll also help fund in-home care for our seniors. Now, unlike those out-of-state tobacco companies, we in Montana don't have unlimited amounts of money to try to confuse folks. But we have the facts, we have the support of doctors, nurses, hospitals, veterans, seniors, the business community, Montana families on our side. Folks have recognized what a difference this makes and the importance of continuing to fund it. And recognize also that last legislative session, that combined with the most expensive fire season we ever had, not this past year, but the year before, it really did strain our health and human services communities when cuts happened. If this money doesn't come in to fund those services, we can fundamentally expect the same in the 2019 legislative session. We have the facts, we have the support, we have the recognition that knowing what a difference this ultimately makes for communities large and small, and for the 100,000 Montanans that have health coverage. And ultimately then we can't let tobacco companies buy this election. If you think about it, they've spent $125 for every single Montanan that got health care. $125 trying to kick that 100,000 Montanans off of health care per. At stake really is those 100,000 Montanans receiving health care today that wouldn't without I-185. At stake is 9,500 Montana veterans and their families who are receiving health care. At stake is the opportunity to help prevent thousands of premature deaths caused by smoking, to make tobacco companies pay for their fair share of those deadly products. We need to continue. Montana is still a state where people talking to people matters. And I think we must continue to educate our fellow Montanans about how important I-185 is to our livelihood, to our healthcare system, to our economy, to our veterans, our seniors, and our working families. Voting for I-185 is not only the smart thing to do for our state, it's certainly the right thing to do. So thank you all so much for your partnership, your dedication and commitment, and thank all of you for being here to voice both your support and gain better understanding of it. Thanks so much.
Hello, my name is John Brewer, and I'm the Director of Outpatient Services at Shodair Children's Hospital, and I'm also a psychiatric nurse practitioner, and I oversee the day treatment program at Shodair. And the kids have come to join us here and present the governor with some artwork because we support I-185. We support I-185 because 100,000 Montanans need health care. We also support I-185 because I'll vote for anything that discourages children from doing tobacco products.
So I'm Carly Sell. I'm the program director of Shodair's Grasslands Acute Care Unit. So we take care of adolescents who are experiencing mental health crises, ages about 12 to 18. So in total, Shodair, we have 74 both residential and inpatient beds. We take care of kids ages 3 to 18 across the entire state of Montana. So up on our wall, we have these really awesome maps that show different places that our kids and families come from, and you just see dots of blue all corners of the map. So it's a pretty amazing reach that we have. So I-185 is something that's really important to me, I think personally and professionally as well. So children in the state of Montana and adolescents are actually one of the highest, if not the highest, in rates of youth suicide in the entire United States. And we have been really since vital statistics started being tracked. Okay. Statistically speaking, just the youth in the United States, 20% of kids approximately are going to be diagnosed and treated for mental health disorders that have significant impact. So that means that that's impacting them at home, at school, in their families, in their communities. So that's not just 1 in 5 kids at Shodair, right? That's 1 in 5 kids on the playground, in the youth group, in your child's classroom, right? And then zooming into Montana, the most recent study the OPI conducted shows that 18% of Montana high school students report that they have seriously considered killing themselves. So in the face of this mental health crisis that we experience in Montana, the thought of approximately 100,000 families or people or children losing services and access to be able to seek services and treatment is just a tragedy that I can't even hardly imagine. Besides the mental health crisis, we also have a new crisis that's beginning to have increasing impact on the children and youth in Montana. So there is a new epidemic of children who are starting to use tobacco products in the forms of vapes, Juuls, and other forms of electronic cigarettes. Okay, so I have a daughter that's a freshman at Helena High, and after her first couple of days in school, she comes home and tells me, "Mom, you're not gonna believe this, but kids are using Juuls and vapes like all over school, in the bathrooms, in the locker rooms, and in the classrooms." And I'm thinking, like, how could this happen? Like, how on earth could they be doing this, like, right underneath the educators' noses who are really committed to keeping these schools safe and healthy, right? Well, then she begins to tell me more about Juuls, and I actually have some to pass around. But these are them. They look like a thumb drive, right? If my child came home with those in her backpack, I would have no knowledge that that was something, that contained nicotine, right? So we'll pass those around. So these, one of these Juuls has the equivalent of 1 pack of cigarettes worth of nicotine, right? And so with this, these products are flavored. So like many of these are like mango flavored and vanilla flavored. They are vaporless, which is what allows them to just suck on them during class. Nobody knows that they have them. And they are easily accessible over the internet. All you have to do is click a button that says, "Yes, I am 18," and they will deliver it to your house, to your friend's house, to wherever you ask. And so we know with, my background in mental health that children and people who have mental health disorders and have histories of trauma are at significantly increased risk for using nicotine and tobacco products, right? And so with this increase of really targeting and marketing towards Montana's youth and other youth, we're looking at children who are going to grow up and have a lifetime of tobacco addictions that are going to cause problems, in their medical field, all around, that really ultimately Montana taxpayers are going to be the ones that are paying for that unless we take some action now. So thank you so much for your time.
Thanks, Carly. That's pretty scary to hear how accessible those products are to our kids at this point. I'm Dr. Todd Wampler, and I'm here to talk to you about I-185 for a number of different reasons today. The first thing that I want to share with you is how tobacco-related illness has affected me on a very personal level. When I was 13 years old, I lost my father to emphysema, a tobacco-related illness. And I was able to see at that point firsthand the devastating effects of tobacco-related illnesses on families. Later, when I was in medical school and I was trying to decide what kind of doctor I wanted to be, I drew on that experience to choose primary care as the area that I wanted to pursue. The whole reason behind primary care is to prevent bad things from happening and to keep people healthy. And so preventive medicine is what drew my passion, drawing upon my experiences. And that's important on a lot of different levels. Now, first of all, what I want to help with I-185 is to try to discourage our children from using these tobacco products, particularly the new vaping products. For the first time, we can raise the taxes on these products and prevent our children from being addicted to these products in the first place. And of course, many of them will choose to become smokers later in life as well and have the whole host of illnesses. And so I'm going to try to prevent those children from being addicted to these products that can cause those shattering effects on the families and prevent them from doing that going forward. Also, as a primary care physician, obviously I'm taking care of patients. And one of the bigger challenges I face is patients who can't afford to come see me at all or can't afford to get the medications that I prescribe for them. And that's why I was so proud of Montana when a couple of years ago we decided to partake in the Medicaid expansion and open up these services to so many of our friends and neighbors. 100,000 people were able to access medical care when they couldn't previously. And that is so powerful, not only to help treat their chronic diseases, but also to provide preventive care. If you think about somebody who's 50 years old and needs colon cancer screening, but they can't afford medical care, and so they don't get their colonoscopy, maybe in 10 years, they're going to be dying from their colon cancer, all because of an illness that we could have prevented when they were 50 years old. And so if you think about the effects of that on a family, a father or a mother who's 60 years old and is now dying of colon cancer that I could have prevented when they were age 50. And we can look at that in a couple different ways. Number one, how many colonoscopies can we pay for with the price that we would spend treating that patient's colon cancer? It's amazing. But of course, that's not the important part to me. The important part to me is the effect that that would have on that family. How much is that worth? And this is one of the things that Medicaid expansion does for us, is that it allows us to provide those services to so many of our friends and neighbors in Montana. The other important part about I-185, as we've heard, is the funding that it's going to provide for our veterans, those who have served our country. I am one of those. I was proud to be a member of the United States Air Force for 4 years, and I took care of a lot of active duty military members, and I was very proud to provide that service. Now, as a private primary care physician, I also take care of a lot of veterans, many of whom, as you've heard, do access the healthcare system through Medicaid expansion. And as so many of our Medicaid expansion patients are, they're working people already, but they just don't earn enough to get their own health insurance plan. And Medicaid expansion is so vital to those people. And through the programs that we're going to provide for veterans through veteran suicide prevention programs that are so important, as well as the other programs that we've heard about, that's the other thing that really strikes my passion about Initiative I-185. And I would encourage all of you to vote for it, talk to your friends and neighbors about how important this is, and help us get this passed. Now, from a veteran standpoint, again, that's very important to me, but I also want to have you hear the perspective of another veteran, and that's why we have Mr. James Holbrook up here to give you the perspective from a veteran. Thank you.
Morning. Like Dr. Wampler said, James Holbrook. Currently serving as the business manager for IBEW Local 206 here in Helena. That's the International Brotherhood of Electrical Workers. I was prior service Army, served as a 31 Fox node center operator. So it's my privilege and my pleasure to be able to try and give back to Montana veterans through this initiative. I'm just going to lay out some statistics for you for how this Medicaid expansion helps Montana vets. Many vets are enrolled in Medicaid for a variety of reasons. 54% of them have a disability, 42% have a chronic condition, and 12% have a substance disorder, and 11% have mental illness. 40% of Montana's non-elderly veterans rely solely on Medicaid for their health care. That's why Medicaid expansion is just crucial for not only veterans, but for all of Montana. Given the vast size of our state, a lot of veterans can't get to a VA center for health care. It's just not physically possible. Medicaid doesn't cut corners when it comes to taking care of veterans. So I encourage everybody to echo everybody else. Talk to your friends, talk to your family. This is very important. Thank you.
Thank you, everyone. Thank you for your comments. I did want to ask Sarah, would you be willing to come up just for a second on behalf of the chamber, just share some of your thoughts with us? I would appreciate if you do that real quick. Would you do that? Thank you, Sarah.
I would definitely be ready. Well, good morning, everyone. I am not a good stand-in for Jason Davis, Chamber President, but he had to scoot out of here, maybe deliberately. I don't know. It's possible. But I am pleased to be here to tell you that the Helena Chamber voted in support by a wide margin for Initiative 185. So I would say that obviously with any Chamber of Commerce, you've got diverse views. So you have those folks that don't like any tax, and you have those folks that of course want to support this initiative because of Medicaid expansion and a lot of the things that the governor and others have spoken about. So there were some differing views expressed, but the common focus that the group was able to coalesce around was Medicaid expansion. Governor, to you and your team for all the work you do in taking care of all those folks who need the help, all of our friends and families, as we've talked about. So that was what we came to, was we need Medicaid expansion. Was the initiative as written perfect? We all agreed no, it wasn't, but nothing is. And we all need to be very deliberate about those who need our help. And we were passionate about that. So again, we're pleased to support this initiative. Thank you for the opportunity.
Thank you all for being with us. Thank you, Governor, again for your time to be with us. We appreciate your comments and those others that have spoken as well. Appreciate your perspective. Thank you so much, Shodair, and for the kids that came and supported us as well. We really appreciate it. I think it's safe to say that none of us want to be the ones who prevent the children at Shodair and their families from getting the care that they need. And so thank you for reminding us of how important that is in this initiative. 185 supports families, it supports our communities, it supports our state, it helps us move forward to be a healthier and stronger Montana. So thank you all for your support in 185. We encourage your participation. Talk with your neighbors and your friends. The governor is right. It's a person-to-person conversation. We can make a difference on the ground. We don't have the money that Big Tobacco does, but we've got the relationships, we've got the friends, and at the end of the day, we care a whole lot more about Montana than Big Tobacco. So thank you for your support and voting yes for 185, and thank you for being here.